Very pleased to see that at this point they've screened about 94,000 members of the community. They need to keep pushing these numbers up, and they've already done over close to 500 tests out of that process. And so we need to keep the numbers up, because we have said we want to go out and discover people before they even get to our hospitals. That's the way we want to reduce the pressure on our health services. I'm very pleased to therefore see that that's exactly what's being done in Mpumalanga. And when we looked at the list of their COVID positive patients, the large number of those would have come from people who have been traveling, and a few of them are contacts. And really we're hoping that we could be able to contain this infection in a number of areas. Particularly our concern is internal transmission, where we would like people to heed the call from the president that people must stay at home, people must wash their hands, people must use the mask, and we want communities out there to use masks. And cloth masks are very, very effective, and so they must continue using them. Hand sanitation, washing your hands. We were discussing with the team inside, the clinicians were even saying we must always remind people that when you wash your hands, wash the tap as well, so you don't touch the tap and then go back and infect yourself. So there are lots of very interesting lessons that they also have picked up, and they're taking it along. Last night we had a long discussion with all the MECs and the Ministerial Advisory Committee, looking through all the issues where we need further clarification. Now our Ministerial Advisory Committee of about 50 or so specialists, and I said about 20 of them are professors. They're divided into so many groups, and what they do every day is to check if there's something new that we need to be guided upon. Then they'll send a whole team to consult people in various countries, in Spain, in China, in US, to find out what their experiences are, look at the papers, look at the latest reports, scientific reports, and then come back with a considered view. So when we raised the issue of the mask, for example, it was an issue that we had asked that they must give us a clear guidance that we're going to use. There are many other areas where we're focusing on what other ideas that we need to send out to all our people. So as of now, we have sent a message. We can't meet all the members of staff. We've sent the message to those who are here that we would like them to know that we are very proud of the good work that they are doing as health workers, that they are in the forefront of our fight, that we want them to be well prepared, to be focused, to be well trained, to be well protected, and therefore they mustn't be seeing themselves landing in a battle without being ready for it. So the training needs to be widespread, and the protection needs to be widespread. We've looked into the protective gear in the province, and we've seen that they've got quite a good amount of PPEs, and so we'll continue to receive new orders and therefore new consignments and making new orders so that we can protect all our staff. So that was really the issue. So we'll go visit the hospital and look at some of the areas where some testing is taking place. But for now it was just to say we're quite comfortable with the plan, even the rollout to prepare for field hospital beds and all of that, and that is in order. The municipality, as you know, the district command council is also active, and we are quite comfortable that everything is in order. So we must just keep pushing to make sure that we can fight this COVID-19. So that was the purpose of our visit.
Minister, we've seen unions actually raising concerns with medical staff getting sick of corona and contracting corona. What are you guys doing to make sure that at least we help out, or especially when it comes to those health workers that have been contracting corona, especially because they are taking away from the people who should be out there helping people?
Well, this has happened to a large extent in a particular hospital in KwaZulu-Natal. We were quite surprised that we ended up with so many health workers infected. The truth of the matter is that the people who know best how to prevent viral infection and bacterial infection are the health workers. So something went wrong, and that's why I've said there must be an investigation to find out how could we get so many of our health workers infected, and we are going to find out what happened there. The concern that the unions have raised is correct. We have actually gone to a number of areas where we have sent our own health department officials to inspect the infection prevention control measures to make sure that everything is done to protect our staff and to protect the patients as well. So we're going to make sure that we find out what happened, but the training must continue, the protection must continue, but the standard operation procedures and the protocols must be followed by private and public so that no staff member gets infected. It's important for us that our health workers must be kept safe and protected. So we will be working on that issue to make sure that this that doesn't continue.
Minister Zweli Mkhize from Newsroom Africa. I just want to check if you discussed the issue of safety, because we have some community workers who chased away. Just want to know if you discussed that as well.
Well, I haven't got that report. What I have heard is that there are instances here and there where some of the communities, out of anxiety, sometimes they don't want to open their doors for the staff to come in and do the screening and do the work they're supposed to do. But it's not common. It's once in a while. And for those, we just explain to them so that they must not be anxious, because there's been fake news. And we actually reported some of the fake news to the police, and work has been done by the police to deal with people who are spreading fake news because they cause unnecessary anxiety. In this case, we found that when our team go all over, they get good reception. We got a report from the MECs that they get good response, but there would be here and there some of those who are anxious and that they say, no, please don't come in. But it's not a common feature. But even then, we spend time to just explain to them so that people mustn't fear. It's all in their interest. They need to understand it that way.
Minister, there have also been some allegations by unions that some private hospitals are not providing training for their staff. What's the say of the health department, and where are you guys when it comes to attending to that issue?
It's the same question. To protect staff, you have to ensure that there's training, that there's protective gear, that there are protocols that are followed. You need all of that together. So I've said that we're investigating instances where there are such reports, and we're also going to make sure that everybody, whether it's public or private, they follow the standard operating procedures and the necessary protocols so that no one has got their own way of managing this issue. It's a standard for everyone, and there is not a matter of choice for anyone. It is mandatory that people must follow the protocols, and so we will keep to that, and we'll investigate where we think that there's need to be taking action. We'll take the necessary action. You'll be aware that we have actually closed down 2 hospitals already, one in Mpumalanga, one in KwaZulu-Natal, and this is going to happen every now and again, and that's the kind of action we take.
Minister, one more question about the testing. It's been 21 days now. Do we think we have done enough testing, especially in communities, in rural communities, where most people, especially who travel from Gauteng and then coming back when the lockdown was announced?
We can never have enough. We can never say we've done enough. We've got 60 million people. It's going to take a long time to finish so many people. And as long as there are people to be tested, we'll continue testing. And so we are doing our very best, and I believe that the health workers have done everything they can to speed up this. I mean, to actually talk about 94,000 people right now, it's a lot, because people were busy with other work and they have to be shifted to do this particular work. It's going to build up over a period, but I want to say to you, I'm happy with the way it has started, and I believe that the numbers are going to be increasing. At a certain point, we'll be able to say that we've got a fair sense of what the infection levels are. We're not there yet. We're still going to push more and more and more. And even 2 weeks is not enough. Even the last 2 weeks is not enough. The next 2 weeks won't be enough. We're going to be running this approach for many more months to come, and we'll actually have to get to a point where we're able to say we've come to an area where there were no people who were having an infection. We'll refer them. So the idea is that when you deal with the issue of COVID-19, it's like where I was explaining to the colleagues here, it's like when you throw a stone in water, the first ring that comes out is a small ring. You need to close that ring and then avoid it going to become a much bigger ring, as it would happen as you move on and on. So what we have to do is to find someone who's positive, deal with all the contacts, find the contacts, test the community in that area, and just make sure we try and kill all the flames before they become raging fires. That's the approach we're taking. So we will be continuing with that. There can never be enough. We'll continue, but we've got capacity to scale it up, and so we'll be doing that. Thank you very much.
Thank you.
Cheers.
Right, the Health Minister there, Dr. Zweli Mkhize in Mpumalanga, just giving us a briefing, talking about the ripple effect of COVID-19. Still very much concerned about the internal transmissions, and we know that the lockdown is essentially about reducing community transmission in South Africa. So that was that briefing by the Health Minister. Now, residents